The average woman deals with menopause and its related symptoms for nearly 1/3 of her life. So I want us to take that in 1/3 of our life, we have to deal with these symptoms. A patient asked me recently, how long, nurse? How long would I have to deal with these symptoms? And I've told her I've met patients in their 80s and still having issues with menopausal symptoms. And as I said before, everybody's experience is different. Some women, the symptoms would not be as bad as others. Some the intensity would ease up as we get older in the postmenopausal phase. But yeah, many women who for many years they have a lot of the symptoms that affecting them on a general daily basis. And that could be, I mean, a lot to deal with if you, especially if you do not have the information readily available to help you, to educate you as to how to deal with the long-term effects of it. So, and while there is a drop in estrogen levels, there are many neurological functions that estrogen deals with, such as memory, mood, that are impacted by these hormonal changes as we go through this transition. So while many women discuss these bothersome symptoms, there are things that can be done and could help improve our cognitive and physical health during this phase. So how does estrogen impact the brain? As women age, as we women, as we go through this transition, and as we age, the body experiences a natural decline in estrogen levels leading up to menopause. So another study said that it starts from your 20s. It drops bit by bit. So usually at that age group, you don't feel it because it starts, small, and then eventually by the time we reach in our 40s, 50s, we start to feel the full effect of the decrease of estrogen. So these levels drop. If at this time it drops significantly, which leads to the end of our menstrual cycle and many changes from the primary function of the body up to that point. Because at that point, the primary function relies on estrogen. So the hormonal changes associated with menopause have been known to cause many symptoms. Many of them we are acquainted with, those of us who are going through it and have gone through it and are going through it post-menopausally already, like the hot flashes. We have the night sweats, which are hot flashes that take place during the night, insomnia, not sleeping well during the night, and all of that affects your health, your brain health, physical health. What about fatigue? Always feeling tired. You sleep, you get up, you're still feeling this tiredness. Muscle and joint pain. Yes, these arise during the perimenopause, menopausal, and many times cases to the post-menopausal phase as well. Mood changes and irritability, as well as anxiety, memory, and concentration problems. Excuse me. Because of the role estrogen plays in woman's brain health throughout her life, the drop of the hormones occurs pre and post menopausally and is often associated with neurological symptoms. Some women will experience cognitive difficulties as a result of heightened anxiety and memory issues. Others experience sleep difficulties, which I can relate to. So sleep is an important part of our daily function, and you're not sleeping well, it affects just about every function that you have to do when you have to function during the course of the day. So that could result in trouble. A lack of sleep can result in trouble concentrating, and of course, it would affect your mood because you're not properly rested. So there are two main areas of the brain impacted by estrogen decrease: the hippocampus and the prefrontal cortex. Now, both of these regions of the brain are related to our ability to learn and to recall our memories. So I want us to take into consideration, we're going through menopause and the decrease in estrogen and all of that, and you can relate now to why you get the brain fog, the forgetfulness, and all the other issues related to your brain not functioning as it used to, the lack of concentration. So we see that the hippocampus and the prefrontal cortex, they have functions. For example, the hippocampus, the main functions of the hippocampus are memory, learning, and emotion. So hence the reason why we can relate now to the brain fog, because the decrease in estrogen affects our memories. So hence the reason why we are not remembering, or we have our memories are not the way they used to be. Learning is affected as well because concentration levels are affected, so we cannot concentrate as we used to, and then our emotions are all over the place as well. So the largest job of the hippocampus is to hold short-term memory and to transfer it to the long-term memory, which is the long-term memory storage system of the brain. It also plays a role in our emotional processing, which includes anxiety. So hence the reason why we have all that problem with anxiety during this stage as well. So the hippocampus, for educational purposes, is actually plural. So we have the hippocampi, which is one, and the hippocampus, which is two, according to if it's the English pronunciation of it or the American. So we have two, one on each side of the brain, one on the left side of the brain, and one sit on the right side of the brain within the temporal lobe, which is located in your skull, near to your temples and your ears. So we can link the reason why these things impact us so much. Then we look at the prefrontal cortex. It is the anterior portion of our brain, of the frontal lobe of the brain, and it affects our general behavior, personality, and it has what we call a function, which is called the executive function, which has higher functions of the brain, which this is in control of as well. So with these two important parts of the brain and the relation to the decrease in the estrogen, we can see how it can affect us in a negative way with the decrease of the estrogen. So additionally, estrogen also, what it also does, it helps support brain elasticity. It pushes our neurons to work harder. It impacts our serotonin levels and our mood. So, we serotonin, what we call the happy hormones, and it helps with anti-inflammatory and antioxidant properties. So we talk about having body pains, bone pains. So with a decrease in estrogen, we can relate how and why we get all those body aches and pains in our body as we go through this process. According to the Penn ovarian aging study conducted by Penn Medicine researchers, they found that more than 1/3 of women continue to experience menopausal symptoms for as long as 10 years after having gone through menopause. Experience these long-term symptoms can affect a woman's mental health, her physical health, and a cognitive health. So fortunately, there are some insights as how to feel more like yourself while your body is going through such a major hormonal shift or a major hormonal change. How can we maintain brain health during menopause? Every woman experiences menopause differently. Some symptoms are more severe, some are not as severe as others. Some symptoms last, the effects of the symptoms last longer with some women, and some women breeze through menopause. As I told you before, I can tell you that with my sisters, I've never heard them have, complain to me of the long-term symptoms that I am going through. So some women's symptoms are more severe than others. It can also impact everything, not just your hormones or your brain, but also your sleep. As we discussed in previous programs, it can affect our sex drive, and it can also affect weight and things like that, etc. So we know how our weight can go up and down at this stage because of how estrogen relates to our system. There are many things that we can do on our own to manage our physical and cognitive changes during this menopausal transition. One of the things we can do is staying socially connected to each other. And this is another way in which we are doing it right now by joining a group with women with like-minded and having similar experiences to share. And it is a forum in which we can also learn and educate one another in terms of what we experience from what somebody else may experience as a woman. So we can learn from each other. So these forums are so important. So it makes you know that you're not going through all these experiences alone. You're not by yourself, and you can relate to what other women are going through as well. Another thing we can do, which is so important, making dietary choices to prioritize whole and natural food. And we could never underestimate the importance of eating healthy, because you know that sugar, a lot of the processed food, and all of these highly sugary snacks and all of that affects us negatively, particularly as we go through menopause. So it is important that we make up our mind to know that the food that we put in our bodies do affect us either positively or negatively. So the onus is on us as women going through this phase to make wise and healthy choices when it's coming to what we put in our bodies. So prioritizing whole and natural food is important here. Avoiding smoking, because we know the effects of smoking, right? Not just menopause, but it can have other negative effects on our system, like, make us more prone to getting certain type of cancers, lung cancers, various throat cancers and other cancers that can metastasize and cause other issues in our body. So we can never underscore how important it is to avoid smoking. What about limiting alcohol as well? Because we know alcohol affects a lot of things negatively in our system as well. So limiting alcohol consumption would be proactive as we go through this transition as well. Controlling heart disease risk factors as well, and this we can relate again to what we put in our bodies, especially if we know that in our genes, in our genetics, in our family tree, we have relatives who have heart disease. These heart disease is what one of these things we call lifestyle diseases, but if it is more prevalent in your family tree, it makes you more prone if you are not taking care of your health the way you should for getting you heart issues, making you more at risk for getting heart issues. And it is important here so that you take this into consideration, because all of these add up to the quality of life that you would have as we go through this transition. What about managing stress? How important is that with dealing with menopausal symptoms? Well, managing stress is vital because we dealt with a topic dealing with stress already, and it affects everything from your cognitive health, physical health, brain health, your general decline physically and emotionally. So managing stress is important. Finding activities that you like, being around positive people, having to do things that you always wanted to do, picking up hobbies, all of these are important. Finding ways and doing, things that, would reduce your stress, like prayer. Some people use a yoga, breathing exercises, or a combination of such, things like that. What about exercising? Another important factor in staying healthy during this phase that affects us mentally. Exercising is important because it keep our body as healthy as possible as we go through this phase. It keeps our stress level down. Is another way of actually reducing stress, exercise. And, the healthier our bodies are, the less we are stressed. So exercise, and what I always tell my ladies is, when you're exercising, find something that you like. Some people say, well, do walking or go swimming or go hiking. You find something that makes you interested, and it would make you do it in a more positive and a long-term way. So exercising is important, but you find something that you like doing, and it would encourage you to keep doing it. Or you can do a combination. There are a lot of things you can do. There are programs you can join online. You can join a gym. You can join a group. You can hire a personal trainer according to what works for you, but get that body moving. So all these things are important. So cognitive behavioral therapy can also be very helpful during this transition. What it does, it takes a long time to go through the entirety of menopause, and learning to cope with it is very important. So cognitive behavioral therapy is something that is recommended, and probably something we can get into on a later show. Additionally, doctors have a wide array of ways to treat neurological symptoms of menopause, specifically hot flashes, mood changes, brain fog, through hormonal and non-hormonal options. There is a lot of misinformation out there, though, about hormonal replacement therapy and how it can be used for treating symptoms of menopause. So, however, we know now that your brain is better protected from cognitive decline after menopause when you do hormonal replacement therapy. Now, we know we like to go natural, but there are sometimes the symptoms are so extreme that we really need to try something else, that it can suppress the aggressiveness of the symptoms. So doctors recommend, if you want to try the hormonal therapy replacement, doctors recommend starting HRT within the first 10 years of menopause. That is, the start of which is marked by 12, 12 consecutive months without having a period. That is how you know that you are menopause. So you go to 12 months without having a period. If anytime during those 12 months a period comes, you have to start counting again from that point until you have 12 months without having a period. So that is how it's diagnosed. So what they are recommending is that you start HRT before the age of 60. In addition, what it does, it reduces your risk of dementia, according to the study done, by 26% when started before age 60. HRT can also lower your risk of colon cancer, cardiovascular disease, and osteoporosis. You know that problem that a lot of women have. You fall, you break your bone, you break your hip, and there's an array of, problems that lead you not down a positive road at all. So what it is saying, if you want to start home HRT, it is recommended that they start it before the age of 60. So, however, according to Dr. Shehade, she knows that it is important to talk to your doctor about HRT therapy sooner rather than later. Because starting hormonal therapy treatments too late into menopause can actually increase your risk of dementia and heart disease by as much as 30%. So don't delay meeting with your doctor to deal with issues and how menopause impacts your body. Now, while the average age of menopause is 51.4 years old, perimenopause or premenopause can start as early as your mid-30s. That is without even any surgery that can usher in early menopause. Some women, in their genes, in their genetics, in their family tree, can have premenopausal symptoms as early as in their 30s. And I have met a few women who have actually started menopause quite early naturally. So I've known one lady, her started at the age of 32. But thankfully, at that point in time, I remember that was so many years ago, even before I was even doing anything with menopause. I remember that she said, I am so thankful that I have children already. I have more than I have 5 children, and I am graciously looking to go through this transition. But I don't know how her process was when she was transitioning, because we lost contact, and that was so many years ago. So as early as in your 30s, that it can happen. So even then, your doctor can work with you to find ways to help you manage symptoms at this junction in your life. So this is not one of our longest topics, but it is a vital topic, that the importance of managing our cognitive health during this time, and what is responsible, so that we would know when the symptoms pop up, what to do and who to go to, and when we are to go to get the necessary help. So at this time, anybody wants to make any comments or ask any questions at this time? If not, we can also, even if you're not comfortable asking me online, you can also contact me after the program so that we can discuss anything that you may be too shy to discuss online. So cognitive health at this time in our life, we should, take, a more proactive step in getting our cognitive health under control, because many of us, we have to work, we have to see about our families, and we want to ensure that, that we are functioning optimally or to the best of our ability during this critical transitional phase, right? So at this point, for those of you all who weren't there from the beginning, the topic we dealt with, which is a short topic, is dealing with our cognitive health, how menopause impacts our brain, and what we can do about it. And I'll recap for us. We dealt with the effects of estrogen. And good night, Miss Atwell. Thank you for coming. And the changes, what that estrogen does to us generally, and how on the parts of the brain. I spoke about the about the prefrontal cortex and the hippocampus, and what they do to, and what estrogen does and causes them to go. The lack of estrogen causes things not to work as they used to. So that is what we dealt with, and we also dealt with things that we can do on our own to manage the cognitive changes during menopause, which some of the things we dealt with was staying socially connected, which I said previously, that is what we're doing now, joining a woman's group, being around, people like-minded. Positiveness is important as well. Making dietary changes and prioritize healthy eating, natural foods, eating foods as natural in their natural states as possible, avoiding smoking, limiting alcohol use or consumption, controlling heart disease risk factors, and by making the proper dietary choices, all of these things can help us to control disease, the heart risk disease factors, managing stress, which is so important, exercising regularly, and practicing mindfulness is important as well. So these are some of the things I spoke about earlier, and we also spoke about hormonal replacement therapy, and we know that there are risks involved, which that risk, more and more studies are going through. It is quite small, but it makes, it it is, you have options with hormonal replacement therapy, because what I've learned, there are some women, their symptoms are so extreme that they try the natural remedies, it is not working. So there is hormone replacement therapy, and there's so much advancement on hormone replacement therapy that, you can find a doctor and discuss what might be the best fit for you and for the type of symptoms you're having, and they, to help you to go through these changes at this time. And there are benefits, as we spoke about. It decreases some of the benefits hormonal replacement can do for us. It can lower our risk of colon cancer, cardiovascular disease, osteoporosis. We know that all these things affect us negatively around this time. So there are pluses, a lot of pluses, with implementing hormone replacement therapy. So this is what we discussed tonight, and I just want to thank you all again for coming on. As I said, this topic is not a very vast topic, but it is very important. So anybody wants to add anything, say anything, now is the forum before we leave the close of our meeting. Yeah, well, I want to thank you all again for coming and to the Healthy Reset tonight. Look forward for another engaging topic that we can learn from, which can be used to improve our general well-being as we go through this transition as women, and even younger women who may be going through it as well, and they finding it hard to deal with and to balance what they are going through, and even speak to somebody about what changes they are going through at this time, because especially if you're a younger woman and you're going through this, it can be hard to speak to some, especially a woman your age group who may not be having any of the symptoms you may be experiencing. So hence the reason why this is an important forum for us as women generally, so that we can learn from other women and from the education that we receive on these sessions that we have. So thanks again for coming, and a pleasant good night to all until we meet again next Tuesday with another engaging topic. Wonderful evening to all.